if the virus continues to stay with us and continues to mutate to milder forms, more infectious but less virulent forms, which is the nature of evolutionary biology. Vaccines don't prevent infection per se. They reduce the impact of the infection. So in order to prevent the infection, you have to protect the virus from entering your body. I believe the time for lockdowns and even travel bans has gone, because you've seen even travel bans are fairly meaningless. The virus has spread to more than 30 countries despite travel bans.
India reported its first 2 cases of the Omicron variant in Karnataka. To understand how this new variant is different from the previous strains of COVID-19 and what precautions you need to take at the moment to stay safe, we have with us Dr. K. Srinath Reddy. He is the Director of Public Health Foundation of India. Welcome, sir.
Thank you.
So, sir, Omicron has already reached India. Can we expect a second wave-like scenario?
Unlikely, but that depends upon what you call second wave. If you're counting the number of infected persons, then you could still have very large numbers. But if you are counting the number of people who are seriously ill, who will get into hospital, require intensive care, and unfortunately may have very severe outcomes, some of them fatal, then it's unlikely that this wave will be as severe as the second wave, for several reasons. Firstly, Omicron, from what we know globally, in the limited evidence available, is only producing a very mild illness and is not really requiring hospitalization. We still have to wait and see though, because the cases are still only about 375 documented and we still need to see the experience. The second is that many of the people in India who have been infected during the second wave with the Delta have acquired some immunity against the virus, and part of that will also protect people from severe illness, even if they're infected by Omicron again. And also, even the vaccines that we have given are also likely to provide some level of protection against severe illness and death against both the Delta variant as well as against the new Omicron variant. And lastly, we are also better prepared in terms of our health system response. We were caught quite unaware and unguarded in the second wave. Now we are much more alert with our systems of testing, tracking and tracing, of home care, of hospital capacity build-up. So I think we are not likely to see the same devastating effect as the second wave.
Right. Since you mentioned about the vaccine efficacy, a few people who are fully vaccinated are also testing positive for the Omicron variant. So can vaccines actually protect us from getting infected, or what can we expect?
Well, the current crop of vaccines that we have were never really intended to protect against infection per se. They were meant to protect against severe illness and death, because these are systemic vaccines administered by intramuscular injection. They produce a systemic immune response which fights the virus after it has entered our respiratory tract, usually the upper respiratory tract, the nose and the throat. Once the virus enters, then the body starts fighting it in the bloodstream with the antibodies and in the cells with the T-cell immunity or the cellular immunity. It doesn't allow much damage to occur, but it doesn't prevent the infection per se. And in fact, people may have a mild illness while the initial fight is going on. So the whole idea that vaccines are going to prevent infection was wrong in the first place. Unless you get mucosal vaccines, which can be inhaled or ingested and can actually create secretory antibodies called the IgA antibodies, which may repel the virus and fight it off even on the mucosal surface by washing it away, we will not be able to prevent the infection per se. However, those mucosal vaccines which have been under development are still under evaluation in clinical trials. We don't know whether they'll be successful or not. We still have to wait for those results. But the vaccines we have, whatever be the platform they've been made in, mRNA or vector virus or inactivated virus, they're all meant to protect against severe effects of the virus damaging the body after it has entered the body. So you cannot really prevent infection with these vaccines.
So, how different is this new variant from the earlier strains of COVID-19, and what new symptoms should one look out for?
Well, the good news seems to be from all over the world that the illness is fairly mild. That is the report from Africa, from different African countries, South Africa in particular, the same report from Netherlands, and the same report from elsewhere too, where in fact 70% of the cases now have been reported from Europe, and they're reporting only mild illness. So the initial report suggests that you have severe headache, body aches, nausea, and things like that, rather than dry cough and respiratory illness, breathing difficulty, and severe respiratory problems causing fallen oxygen content. Those are not the kind of symptoms that are being seen. But it's early days yet, because the illness has been documented in South Africa mostly in young but unvaccinated people. But young people generally do tend to have mild illness. And the illness has been initially documented in Europe in travelers who came in after vaccination. So they are also likely to have mild illness. So we'll have to wait and see whether this is true of unvaccinated elderly people who get infected with Omicron. But at the moment, the information is reassuring that this is mild illness.
Right. So, what precautions one need to take to stay safe from the infection at the moment?
As I said, vaccines don't prevent infection per se. They reduce the impact of the infection. So in order to prevent the infection, you have to protect the virus from entering your body through the nose, through the mouth, or the eyes. And therefore, you have to wear a mask, definitely, when you're outside the house, and try and move in well-ventilated areas, because in well-ventilated areas, the virus cannot form and hang around as clouds, and the chance of infection are less. And third, of course, the usual hand hygiene and hand washing are important. And therefore, both against what we call aerosol infection and against droplet infection, you must observe these precautions definitely. And avoid crowded events. The virus travels with people and celebrates with the crowds. Don't give it an opportunity to spread easily. And therefore, avoid crowds, especially in indoor, ill-ventilated areas. And that's very, very important for us to observe. And then, of course, get good sleep, drink adequate amount of water, eat nutritious food with a lot of fruits, vegetables, and nuts. They build up your innate immunity so that even if the virus enters the body, you will be able to fight it off whether you're vaccinated or not. That will be a substantial help. And of course, if you're not vaccinated, do get vaccinated, because vaccines will help to some extent in reducing the impact of the illness and making it a mild illness rather than a severe illness. Though, as of now, it appears that even in unvaccinated people, Omicron is producing only mild illness.
Right. So, sir, do you think that there is a need for reimposition of a national lockdown to contain the virus spread as a precautionary measure?
No, I don't think so. I believe the time for lockdowns and even travel bans has gone, because you've seen even travel bans are fairly meaningless. The virus has spread to more than 30 countries despite travel bans. We have had one person in Bangalore infected even before South Africa announced that they found the virus. Same thing in Netherlands. They have now detected from previously collected samples that the virus was there on November 19th, whereas South Africa had announced it only on 23rd of November. So travel bans are not going to really prevent. They may slow down to some extent, but they'll not prevent the spread of the virus. Same thing with the lockdown, because right now we have learned that we need to prepare our health system, but also observe public health precautions. And if we actually manage to do that, we don't need the lockdown. And particularly if the illness is mild, it actually may enhance the immunity of the people who are infected. But we have to still wait and see what the impact on immunocompromised people is, what the impact on elderly is, and they have to be protected. both with the vaccines as well as with the masks and other precautions. But going into a lockdown is not going to help anybody. Going into travel bans is not going to help anybody. It is actually going to impede health services. It is going to disrupt the supply chain globally. And what we need to fight the virus won't be available to countries in time. And therefore, I believe having a hasty, overreactive response is not going to be very helpful.
Right, right. Since many experts predicted, that a new strain, if that comes, then there will be a third wave. There is a possibility of a third wave. So, what are the future predictions based on the statistics at the moment?
Well, as I said, depends on how you want to define the third wave. If you're going to talk about a third wave of mild infections, yes, like common cold and maybe body aches, yes, we'll have third waves and fourth waves and fifth waves if the virus continues to stay with us and continues to mutate to milder forms, more infectious but less virulent forms, which is the nature of evolutionary biology. There are other respiratory viruses which have evolved like that, started off as very virulent, but later on reduced their virulence to gain more infective nature. So that may happen. But if you're counting third wave in form of severe illness, hospitalization and death, I don't think we'll have third waves at the same magnitude as the second wave. So we'll have to wait and see how that works out. See, Europe is having a different experience because now they're still experiencing the Delta wave. Yeah. We experienced it in our summer. Europe is going through the big Delta-driven wave. But the Omicron wave, if it results in a third wave, is unlikely to be as severe as the Delta-driven second wave.
Right. So after the detection of 2 cases in India, what government is doing at the moment to, to keep the people safe, or to keep the country safe from a new, outbreak?
Well, they're advising people to have caution in their wearing masks, avoiding crowds, reducing unnecessary travel, screening incoming travelers from other countries, and basically advising isolation or quarantine as per need based on the test result. And they're increasing the level of testing, they're increasing the level of genomic analysis. All of them, that is important. But some of the state governments, I believe, by imposing more than necessary restrictions and pleading for travel bans, I think they're misjudging the situation.
Right. The Swasthya Sahayak team has developed a digital solution which can be used by ANM, ASHA, voluntary workers to identify individual and their household members who are at risk of, contacting the virus and the symptoms. Can you talk a little bit about this as well?
Well, digital technologies are extremely useful in point of care diagnostics, but also in trying to help the frontline health worker identify what the symptoms are, and based on algorithms, they can even manage, but more importantly, they can even have diagnostic criteria which can be put on the digital tablet, and they can assess whether the person is at a low risk or a moderate risk or a high risk of having the infection, and appropriately advise home care or referral for testing and so on. Now, testing also can be done, but testing now is being given only by permitted agencies and with permitted techniques now for testing. But at least in terms of clinical symptomatology and clinical management, the handheld tablets can be of great use in the hands of healthcare physicians. But if rapid diagnostic tests also are incorporated into that, then home testing is also made much easier. So I think we ought to use our digital technologies to support our frontline healthcare workers in order to have an early diagnosis, both on clinical grounds and on the basis of early testing. And then do management appropriately based on home management for most of the people and deciding who needs to be referred for hospital care.
Right, right. So, anything that I have missed, like, would you like to add on to the discussion that we just had? Anything from your end?
Well, I believe it is absolutely important for us to understand that vaccines also will be differing from one another. For example, the mRNA vaccines produced a huge amount of spike protein response. They had a huge surge of spike protein. And that is because they were geared only against the spike protein. Now they are proving less effective against the variants because the virus has developed the spike protein mutations. They became less effective against Delta, though they did protect against things like severe illness and hospitalization, but they became less effective overall. And now against Omicron, there is a feeling that they will be even less protected. In fact, the CEO of Moderna has said that there'll be a substantial decline in the efficacy of their vaccine or other mRNA vaccines against the Omicron because of the large spike protein mutations. And now they're trying to tweak their mRNA vaccines to produce new vaccines. But this cycle can go on and on. They can tweak their vaccines and produce new mRNA vaccines, and the virus will have more spike protein mutations to counter it at some other stage. Same thing with the virus vector vaccines, which have been specifically directed against the spike protein. They may fare better, a little better than against than the mRNA vaccines, but even they will have reduced efficacy because they are also mostly against the spike protein. But we have to wait and see whether the inactivated virus vaccine that is being developed in India and some other countries, because that presents the whole virus to the immune system and with multiple antigens and with immunity directed against multiple antigens, may not be as effusive as the spike protein antibodies of the mRNA vaccine, but much more broadband. So whether that is going to be more effective in countering the variants, that needs to be seen. Theoretically, it is possible, but we still need proof. So we are waiting for proof from the National Institute of Virology, which is going to be testing the Covaxin as well as the Covishield and other vaccines against the Omicron variant. So it is possible that our vaccine strategy globally also may change based on how the Omicron is adapting itself to the vaccines and whether we need to modify our vaccines or use different platform of vaccines for countering such variants.
Right. Since the vaccine topic came up, do we need a booster dose to fight this new variant right now? Because since both the even fully vaccinated people are getting infected, though the infection rate is the severity is low, still, do we need a booster dose as the other countries are, giving their own citizens?
Well, it depends on two things, or rather three things. Firstly, it depends upon which vaccine has been used for the original vaccination. Secondly, it depends upon the characteristics of the person who received the vaccine. And third, it depends upon the nature of the variant that is in circulation. So if you are really looking at the vaccines that are being used in US and mostly in Europe, it is the mRNA vaccines, which seem to have a short duration of action. The virus vector vaccines have a slightly longer duration of action, but they are also fairly spike protein specific. So there is a problem there where you may require a booster dose in order to supplement the effect of the initial doses, particularly in people who are at high risk, that is elderly people who are having immunocompromised state, or people who are in health workforce who are likely to get a high viral load because they see many patients. Now, because most of these vaccine doses in those countries were given when the original virus or the alpha variant was in circulation, and now that they're seeing the brunt of the Delta variant, they are now requiring booster doses. Whereas in India, we got most of our exposure to the Delta variant during the second wave. And therefore, we may not require that much of a booster dose. Secondly, we have used not the mRNA vaccines, we have used the virus vector vaccine, that is Covishield, and we have used the inactivated virus vaccine, that is Covaxin. We still have to see, they also will have a waning immunity. They may require booster doses at some point in time, but they will probably require only for the elderly people, for the immunocompromised people, whether they're young or old, and for health workers who are more likely to be meeting a number of patients and therefore are at a danger of high viral load exposure. But Omicron itself does not call for booster doses for everybody, because at the moment it appears that it is producing only a mild illness.
Right. Thank you so much, sir, for giving us your time and letting us understand so much about this new variant, so that we can stay safe and we can understand how this can affect us. Thank you, sir.
Thank you.